Ladies and gentlemen, I am Daniel Hall III, and I will be your host for tonight's Men's Health Awareness 2020 webinar series. I am the Social Action Director for the state of Delaware. I am also a proud member of Phi Beta Sigma Fraternity Incorporated and the mighty chapter of Delta Gamma Sigma based out of Dover. It is with great pleasure and honor that I introduce you to our exceptional guest speaker for tonight's webinar, Mr. Weston James. Mr. Weston James is a member of Omega Psi Phi Fraternity Incorporated. He is also the husband of Naisha James and a father of 8 and a grandfather of 5. He graduated from the University of Phoenix with a Bachelor's of Science in Information Technology. Mr. James also has a master's from Goldie Beacon College in Management. He also enjoys spending time with his family, weightlifting, riding his motorcycle, basketball, and practicing Taekwondo. As a son of 2 cancer warriors, I am humbled by the willingness and the courage of Mr. James to share his story with us. But before I move on, Mr. James will be blessing us with his musical talents as our DJ. So I ask that you stick around and enjoy some great music as we party with the purpose after this important information. There will be prizes. And as a reminder, the Men's Health Awareness 2020 webinar series will continue next Sunday on the 27th of September with a panel of 5 prostate cancer survivors. And without further ado, I present to you Mr. Weston James.
Good evening, everyone, and thank you for showing up this evening, taking time out of your day. Before we get started, I'd like to show you a quick video of Polycythemia Vera. It's known as a blood, and the video will give you a little introduction of what it's about.
Common type of blood cells in our body, and they play a crucial role in our health by carrying oxygen through the body. We're talking about red blood cells. But what if we had too many, a progressive overproduction of them? Today we're looking at a rare disease, Polycythemia Vera, or PV, a chronic blood cancer that can lead to complications including blood clots, resulting in serious health problems such as a heart attack or a stroke. While there remains no cure, physicians and other medical professionals are helping patients keep their PV under control. Coming up, who is at risk, and one patient's personal story of courage and vigilance. I'm Olga Villaverde. Access Health starts right now. Polycythemia vera, or PV, is a rare, chronic, progressive blood cancer in which your bone marrow makes too many red blood cells. These excess cells slow down the flow of blood through arteries and veins. This could lead to clots, which may cause deep vein thrombosis, DVT, heart attack, or even stroke. For patients living with PV, paying attention to your health and symptoms is critical, always.
I think the most stressful thing was the unknown. That was very controlling, the uncertainty of what's going to happen next and when it's going to happen.
I had finally figured out what was causing all of these symptoms, but then also okay, what next?
Keep track of every piece of information that you can get from your doctor.
Everything I read was telling me, you have a timestamp on you. This is going to end.
Those were the voices of polycythemia vera patients dedicated to managing this cancer as a chronic disease. What is PV? How do you know if you're at risk? And what can be done about it? Joining us today to answer these questions and more is Dr. Shahar Pellis, an oncologist and hematologist. Good morning. Thanks for being here. Let's talk about it. What exactly is PV and what causes it?
So polycythemia vera is part of a group of cancers known as myeloproliferative neoplasms. It's the most common disease in that group. It's caused by a genetic mutation in bone marrow stem cells that eventually leads to the overproduction of blood cells, especially red blood cells. Now, even though it's caused by genetic mutation, polycythemia vera is not considered an inherited disorder. In fact, most patients with polycythemia vera do not have family members with a history of the disease. It's slightly more common in men, and even though it can be diagnosed at any age, it is more common at more advanced ages.
What symptoms should we be aware of?
So most of the symptoms of polycythemia vera are fairly nonspecific. Things like generalized weakness, fatigue, bone pain. It can cause sweats, particularly at night, itching, especially after a warm shower, numbness in the hands and feet, a red face. And many of these symptoms are caused by overproduction of proteins known as cytokines that cause inflammation. Many patients with polycythemia vera have splenomegaly, which is an enlarged spleen, and that can cause pain on the left side of the abdomen, and also something we call early satiety, which is a feeling of abdominal fullness or bloating, even after eating very small amounts of food. And then there's patients that are asymptomatic and they're diagnosed incidentally because they have routine blood work that shows an abnormality in their blood counts.
So it sounds like it could be pretty difficult to diagnose. So how do patients confirm that they have it?
Yeah, so many of the symptoms are nonspecific, and this is a rare disorder. So the healthcare professional evaluating the patient really needs to consider this diagnosis. And if that healthcare professional is suspecting polycythemia vera, then they need to order the appropriate blood tests, look for the genetic mutation that's associated with the disease, and then determine whether a bone marrow biopsy may be necessary to confirm the diagnosis.
We know there's no cure for PV, so how can it be treated and managed?
So it's a chronic disease. Patients need to figure out how to live with this disorder for many years. It's also can be a progressive disorder, meaning it can increase in severity over time. So healthcare professionals and patients need to work together to understand their symptoms and institute an appropriate individualized management plan for each individual.
Now, doctor, you're going to be back a little bit later with more information, but first, I want everyone out there to hear from one very special lady who had...
All right, once again, thank everyone for joining. As you can tell, polycythemia vera is considered a cancer, is considered a blood cancer. And we're going to go through a few PowerPoint slides just to explain how I've been dealing with this for so many years. So once the PowerPoint slide comes up, we'll get rolling. So as you can see, it's polycythemia vera. It's also sometimes called polyvera or PV. Next slide, please. So I wanted to start off by just showing you that in general, if you know me, you look at me, you would never know that I have cancer, basically. I'm 5'10", 56 years young, 240 pounds, give or take, children, educated, got hobbies. As you can tell, I enjoy riding my bike. Also, I enjoy our community service and events we do as far as my fraternity is concerned. And one of the examples I like to use also is the Chadwick Boseman. Everybody knows him as the Black Panther. Nobody knew that he was dealing with colon cancer. And just by looking at him, you never knew he was dealing with it until towards the end when he started to lose the weight. Kind of the same thing here. Nobody knows by looking at me that I have this disease. Next slide, please. So how did I find out about this disease? Basically, when I turned 40, I decided to start taking, being a little more proactive as far as taking care of myself and started getting a yearly physical. Around 45, my primary care physician noticed that my red blood cell count was really, really high. And he thought I had cancer. So he sent me to the cancer center at the Christiana Hospital. And the doctor there, they took tubes and tubes of blood so they can test. On my follow-up visit, he said, I got good news, you don't have cancer. However, you do have what is called polycythemia vera, which is a blood cancer. And, when you hear the word cancer, honestly, I didn't freak out or anything. I just, all right, so what do we got to do? And he said, and his exact words are, we must bleed you. And I'm like, well, what do you mean by that? He said, because your levels are so high, that for the next 6 months, the first Friday of the next 6 months, we're going to have to take a pint of blood from you until we get your levels down. Hopefully by the 6th month, your levels will be down. So basically the first Friday of every month, I went to the cancer center and they had a room in the back with cancer patients. So I was actually in the same room as regular cancer patients that have the traditional form of cancer. I was also in that room with them as well. And they would take blood from me. Now, what's weird about this is when you give blood, normally you have a traditional needle. That's the basic size needle. Well, this type of donation, the needle, as I always tease them, but to me, that's what it felt like. The needle was the size of like a crochet needle. The thing was huge. And one thing that I found interesting was the nurses who were to administer this, take my blood. And one of the nurses came to me afterwards and actually told me this. She said that we were in the back debating on who was going to stick you. Because that needle was so big, they were in the back debating on who was going to stick me. And I was like, wow, I just thought that was interesting. So basically for the next 6 months, the first Friday, every Friday I went in, the first Friday every month I went in, gave my pint of blood. And for me, it didn't bother me. You know, some people, when they get blood, they get dizzy, they get lightheaded, whatever. It didn't bother me at all. There was a couple of times when I actually rode my motorcycle up, gave my blood. They make you sit for that half an hour, make sure everything's good. They gave you some snacks. Once everything was good, I'd jump on my bike and head back home. So it really didn't affect me per se. After 6 months, my levels came down. So my doctor was like, okay, we're going to wait 6 months and see what happens. 6 months came, my levels shot back up again. So then he's like, okay, we're going to do the same thing, but now we're only going to do it for 3 months because my levels weren't as high, but they were still above where they're supposed to be. So for the next 3 months, the first Friday, I was getting that crochet-sized needle stuck in my arm for them to take a pint of blood. Once the 3 months were up, then we came back and we decided, okay, it seems like basically every 3 to 4 months, I have to give a pint of blood. So right now, for the rest of my life, every 3 months, every quarter, give or take, I have to give a pint of blood every quarter for the rest of my life. Next slide, please. So as they stated in the video, and that's why I'm kind of glad we were able to show the video, I'm not going to try to pronounce this, but MPNs is the abbreviation for that long word that the doctor mentioned. MPNs, there are 3 primary blood disorders that fall under MPNs. Polycythemia Vera is the primary blood disorder that's most commonly known out of these 3 that fall under this MPNs. Next slide, please. As mentioned, approximately, it's a rare disease. Very few people have it right now. And I just recently did the research just to make sure the numbers didn't change. Only about 100,000 people in the United States are living with PV. Normally, it affects people when you're older, but when I was doing my research also, I noticed that younger people are starting to see this as well, as young as late teens, 18, 19, 20. We're starting to see that they have this disease as well. But in common, it usually affects people as you get older in age. And also, it usually affects men more so than women, but it can affect both races. Next slide, please. So polycythemia vera, as they mentioned, is a rare blood disease. And in a nutshell, your bone marrow produces red blood cells. If your bone marrow produces too many red blood cells, it can cause your blood to clot. It can cause you to have major issues associated with blood clotting. For example, heart attack, stroke, some numbness, things like that can be symptoms of your red blood cells, your bone marrow producing too many red blood cells. Also, if your bone marrow produces so many red blood cells, then the bone marrow and the blood cells, in a sense, they talk to each other. And okay, we don't need to, and the bone marrow saying, okay, we don't need to produce any more red blood cells because you have enough. So your bone marrow will stop producing. when that happens, then your bones can get brittle and they can break. So that's another reason why I got to keep my levels at a certain level, because I don't want my bone marrow to stop producing red blood cells, because in turn, I will end up having broken bones, and they can just break and snap and all that kind of stuff. It is not generic, hereditary so far, or anything like that. So as far as I know, in my family, I'm the only one who has this. Everybody's case is different depending on your symptoms, but in general, everybody's case is different, and how you get treated is different as well. Next slide, please. So for me, when I was younger, I had all these crazy things going on, and I just figured it was just something that I had to deal with. That was just part of my life and my experiences. I never understood why when I got out of the shower, and you'll see the symptoms later on, but I never understood when I got out of the shower, why my skin would itch. I never understood when I'm sleeping, why I'm sweating and all that kind of stuff. So my symptoms were different than probably the next person. But as I mentioned, as far as this disease is concerned, once again, the way it was detected was through a routine physical. My routine physical, my doctors noticed that my red blood count was too high. We went to the cancer center and we found out that I have Polycythemia Vera. And as I stated, blood clots can cause stroke, heart attack, blockage of the artery in your lungs and or veins, deep within the muscles and arms and legs. I got blessed and lucky, in my opinion, because most people don't find out, 30% people, I should say, find out they have PV when they have some type of cardiovascular event, i.e. stroke or a heart attack. Like I said, I found out about mine through a routine physical with my doctor. I am blessed because I did not have a cardiovascular event happen for me to find out I have this disease, this cancer. Next slide, please. So as stated, some of the symptoms, and there was a whole list as I'm reading these symptoms, and as the saying goes, you start putting two and two together. And now I started understanding when I was younger why I was going through some of these things I was going through. And as I got older, these things started to get worse. Now I'm starting to understand. So for me, as I stated, one of the symptoms, as soon as I got out of a hot shower, my skin would dry up and crack and itch like crazy, to the point where, I would welt. For me, as crazy as this may sound, I tried everything under the sun. I tried bathing and stuff. I tried this lotion. I tried this cream. I tried a combination of lotion and creams. I tried putting it on while I'm in the shower. I try putting it on when I get out of the shower. I try putting it on before you dry off, after you dry. Everything under the sun, I tried. Nothing worked. The only thing that works for me to this day, the only thing that works for me, as crazy as it may sound, is Vaseline. I like you put a very thin layer, like you would do in your hands. I put a very thin layer on me. That's the only thing that works for me. Nothing else seems to work as far as keeping me from getting that itchy feeling on my skin when I come out of the shower. Sweating, as I stated, there's been times I'll wake up, my pillow's soaking wet, my covers are soaking wet, my clothes are soaking wet, and this could be spring, summer, winter, or fall. It doesn't matter what time of the year is. I'm just sweating like crazy. I'll kick the covers off. I'll put the covers on. It doesn't matter. I'm just sweating crazy, like crazy. Blurred vision. Now, this happened, and this kind of woke me up when this happened to me. But blurred vision, I was sitting on the bed watching television, and then all of a sudden, it's like somebody said, fade to black. My vision started going away, and it was like I was looking down a tube of like a straw. And I'm like freaking out because I'm like, what is going on? So I got up, I walked into the bathroom, I flicked on the light. I could see the little bit of light coming through, but my eyesight, I couldn't see nothing. And my vision was almost like, they're almost gone pretty much. I felt like I was blind. in a sense. About 5 minutes later, give or take, my vision came back and I was good. Blurred vision, blind spots, that's happened to me a couple of times, but that was the worst case scenario that's ever happened to me because I could not see nothing. I'm standing in the mirror. I can see like the shadow of me in the mirror, but I couldn't see me clearly at all. I felt like I was going blind. And like I said, 5 minutes later, it went away. I'm like, okay, cool. And that kind of woke me up a little bit, but still being a male, I didn't take it as seriously as I should. And I'll tell you what finally kicked in on the next one. Painful, burning numbness of the hands and feet. This here, it's like, imagine somebody's taking a bunch of needles and sticking them in your fingertips and the tip of your toes. Somebody's taking a bunch of needles and sticking them in your fingertips and the tip of your toes. That's what this felt like to me. Sticking painful in my fingertips and my tip of my toes, it was excruciating pain. It's hard to explain, but just imagine somebody, like I said, sticking needles in your fingertips, or they're taking a hammer and hitting your fingertips or something like that. But that's what that pain felt like. Or if you ever like drop something on your foot type thing. And I guess another example you can kind of use, if you ever hit your funny bone and how everything goes numb and you get that tingling feeling, or if you fall asleep on your arm or your leg or something like that, and when you finally stand up or you let your arm out and you can feel that sensation come back and your hands start tingling, multiply that by 10 or 20, 10, 20, 30%. That's how it felt on my fingertips and the tip of my toes. It's hard to explain, but excruciating pain. Next slide, please. So one of the things I didn't highlight in here was when I eat, I can't eat like a full meal. I have to eat small portions because I do get that feeling of being full, one, and then also that pain under my left ribs. I get that sometimes. If I eat too much, I get that pain under my left rib. So I didn't highlight those two, but those are two feelings I also get. Dizziness, vertigo, lightheadedness. This right here was a second instance that woke me up. Vertigo, if nobody knows what vertigo is like imagine being super drunk on top of having a really bad headache and really nauseous. That's kind of what vertigo is. Somebody spins you around in a circle real fast, and then you're trying to walk and you're stumbling. Magnify that. So that's why I said super drunk, but at a tremendous headache, and I mean tremendous headache, and nauseous. Like put a point where when it hit me my first time, I had pulled a trash can over because I just knew I was getting ready to get sick. Vertigo is no joke. It hit me hard once, where it lasted for about 10, 15 minutes, and then it finally went away. Normally, it's like a passing wind. It'll hit me. I know it's coming. It'll hit me. I'll stop what I'm doing, let it run its course, and then I'm back to doing what I was doing. The one time it hit me, another time that it hit me, I was on my motorcycle riding home, and I could feel it coming, and it hit me. And I pulled on the side of the road, and I just sat there for a minute, let it run its course, and then I was good, able to jump on my bike and head on home. Redness of the face and burning feeling in the skin, like I mentioned earlier, that usually happened I didn't get it too much in my face, but in my fingers and my feet, my toes. Those were where that burning, that tingling, heavy burning feeling really hit me. This right here is what woke me up. It's called angina. Angina is another word for chest pain. So I'm sitting on the couch watching Columbo. It was an old school Columbo movie. And my chest started pounding. I mean, like pounding. I can almost hear it pounding. So I laid down on the couch and I put the remote control on top of my chest so I knew where it was. And I'm looking at the remote control, and you can actually see the remote control moving, going up and down on my chest. And I'm like, whoa, something ain't right here. Something ain't right here. And it wasn't painful or anything. To me, it wasn't painful. It was just the fact that it's like if you're running, you ran a long distance, and all of a sudden when you get done, you can feel your heart pounding real hard. And magnify that. That's what it felt like. And to be able to see my remote control on my chest, not on my stomach, I had it on my chest. You can see the remote control going up and down on my chest. So I took my baby aspirin that night. The next day I went to work. Didn't feel as bad, but I still had some of the effects. So I let my manager know, and I called my doctor, and they told me to come in. And when I got to the office, they hooked me up with all that, the electrodes and everything, and took that EKG or whatever it's called. And then my doctor came in and read the paper, and his exact words were, "I need you to go to the emergency room now. Do you need me to call an ambulance?" And I'm like, no, I felt good enough to drive. So I drove myself to the Christiana Hospital in Wilmington off of Washington Street. They had me there for almost 6 hours. And I mean, they did every test they can imagine because they thought I was having a heart attack. They did every test they can imagine. They came and took blood from me 2 or 3 times, had me hooked up to all kinds of stuff, had me sit there for a while, came back in, ran tests again, took blood again. Everything came back normal. So they suggested that I do a stress test. So one of the things I had to do was part of a stress test. If you never had one, it's interesting. You run on a treadmill. They shoot this dye into your veins. They put you in this machine. They watch to see how your blood travels. All that was done. Everything came back normal. I had nothing wrong. Went back for my revisit with the doctor. Everything came back normal. So they just thought maybe it was one of them freak things. But for me, angina was what woke me up and realized I need to take this Polycythemia Vera. I need to take this a lot more serious than what I was doing. Next slide, please. As I mentioned, the pain, that basically comes, it could come, they say, from complications of an enlarged spleen. They checked that. I didn't have at the time, and I still don't, as far as I know, the enlarged spleen, but the feeling of feeling full, or the pain under my left rib. I mean, I haven't felt that in a while because I know now I eat portions. I don't eat like a full meal. I might eat half or small portions, so I don't get to that point because it is very painful. It's one of them things like if you got a cramp in your side or something like that. It's very painful, something along the line. So I know it's probably still there. I just haven't experienced it lately, or in a while, I should say, because I know I got to eat smaller portions to avoid stuff like that happening. Next slide, please. So for me, as far as treatment is concerned, as I mentioned earlier, I have to give blood every quarter for a pint of blood every quarter for the rest of my life, or until they come up with a cure, which right now there is no cure. So I have to give blood every quarter for the rest of my life. So that crochet size needle they stick in my arm every quarter for the rest of my life. As far as the bone marrow, to prevent me from having brittle bones, I have to take a D3 bone capsule. I take that every morning. I take one every morning. And then as far as keeping my blood thin, I have to do a baby aspirin every night before I go to bed. So these 2 items right here, the bone capsule and the baby aspirin, along with the once every quarter phlebotomy, I have to do that for the rest of my life if I want to continue to maintain. And as my father would say, I'm walking on it and not buried under it. If I want to continue to be upright, I have to do this for the rest of my life. My blood cell count for me has to stay between 12 and 18. And if you ever gave blood, when they prick your finger, they put it on this little glass and they slide that glass in a little machine, and that's what counts my red blood cells. As long as I'm between 12 and 18, I can donate blood with no problem. If my count is below 12 or higher than 18, immediately they would tell me, no, I can't do it. You need to go see your doctor. So I got to make sure. And that's basically, instead of me going to the cancer center, when I go to donate blood every quarter, that's how I keep track of my count. And then I report that back to my doctor to let them know I just gave blood. This is my current count. And that's how we keep track of what my count is, by doing my blood donation every quarter. Next slide, please. So in summary, For me, living with polycythemia vera, which is known as a blood cancer, for me, if I want to continue to live, then I have to donate blood every quarter, 1 pint of blood. My levels have to be between 12 and 18. I have to take a bone capsule, a little gel capsule that I take every morning. And then I have to do a baby aspirin every night before I go to bed. Proper dieting, I mean, they really didn't say anything about dieting per se, but proper dieting in a sense, you know, I don't do salt. I don't do fried food as often as I used to. Every now and then I still need my little piece of fish or my chicken. But in general, I don't do salt. I don't do fried food. I try to drink plenty of water. I should exercise more than I do. But exercising in a sense, I do walk a little bit, but not too much. But exercising and pretty much watching what I eat, that's just my choice. There's nothing out there that says, as far as polycythemia vera is concerned, there's nothing out there that says you should be eating this and you should be doing this. I haven't seen anything that states that. Secondly, as far as this disease is concerned, I haven't read anything as far as it affecting just minority races, people of color, or otherwise. From what I've read, it can affect anybody, any race. Usually it's older, but it seems like it's starting to affect younger. So it pretty much anybody can have this. Right now, there's no scientific evidence that shows that it's hereditary. So usually no family members will have it. It's just something that we get, we have, we got to deal with. If you want more information on this, you can always Google polycythemia vera, or you can YouTube polycythemia vera. There's a lot of information out there. Some of it gets real technical. I don't need to know all the technical aspects of it. I just need to know, you know, if there's any new information as far as how to treat this. Thank you guys. I appreciate you for listening and taking the time out of your evening to listen to my presentation. If anybody has any questions, I'm more than welcome to answer any questions at this time.
Thank you, Brother James. We do have a couple of questions from the audience.
Okay.
The first question is, do you still have symptoms since you started your treatments?
My symptoms aren't as severe as they used to be, once again, because I'm keeping my levels within that range. However, just out of curiosity for me, and I learned my lesson after this first run, this first little test I did, I decided not to take the baby aspirin for 2 days. And on that second day, my fingers started like they were on fire, and my feet felt like they were on fire. So as long as I'm taking the baby aspirin, I'm good. My fingers don't bother me. My feet don't bother me. I'm watching as far as my portions are concerned, so I don't get that pain in my side and underneath my rib cage on my left side. The vertigo, if it hits me, it comes and goes like within a couple of minutes. It doesn't hang around like it used, like the first time it hit me when it hung around for 10, 15 minutes. And when I say that was brutal, that was brutal. Felt like the room was just, it was brutal. But when it hits me, it comes and goes. As far as being out in the sun, that still affects me. So I can't be out in the sun too long because my skin will welt up and it looks like somebody beat me. That's how bad it gets. So my skin will welt up, so I can't be out in the sun too long. And if you ever was to come by my house on a summer day and I'm cutting grass, you would think it was wintertime because I'm covered from head to toe. I got a mask on, I got a hat on, I got long sleeves on, I got long pants on, because out there cutting the grass, I can't be out in the sun that long because my skin will get affected.
Okay, thank you. Another question in regards to the itching. How long does the itching spell usually last? And we know you mentioned Vaseline, but is there any other over-the-counter medicines that help?
So for me, the itching lasts until I jump in a cold shower or a cool shower. Until that happens, that itching will last until, like I said, until I jump in the shower. So normally when I feel that coming, I gotta put something cool, compress or something on me real quick, because that takes away that feeling. As far as what's over the counter, I haven't tried anything since I realized Vaseline works for me. So I'm sure they probably got new products out there on the market, whatever. But to understand, when I say I come out of that shower and my skin feels like it's crunch and cracking, I don't want to feel that. So I really haven't tried anything new. Vaseline works for me. If it ain't broke, I ain't gonna try to fix it.
Okay, thank you. Another question we have here is, after being diagnosed, do you believe that there were some symptoms that were being presented earlier in life?
Yeah. Oh, definitely. So when I was younger, playing sports, for example, you always had to get your physical. We always had to get a physical before we could play any sports. And I used to go into the doctor's office, and before they stuck the needle in to take my blood so they can test it out and all that, I used to always warn them, I'm going to squirt. And they looked at me like cross-eyed. I mean, they looked at me crazy. I'm like, I'm telling you, once you stick this needle in me, that my blood is going to squirt out. And now I realize it's because I had so much blood in my system. So when you stuck a hole in me, it shot out on it. And then literally, once they pricked me, now when I go give blood now, I let them know, they put a shield on because of, you know, everybody's health conscious now. So now they put a shield on. But younger, when they used to stick me, I used to squirt on people. As I mentioned, we were on this is the first time it happened. Me and the family, we were down at the Baltimore Harbor. And this is the first time I realized, okay, something ain't right, because that was the first time when my skin broke out, that we were walking around in the sun. And all of a sudden I just felt this burning, itching sensation on my shoulders. And we ended up going to the store. I bought a little bar of soap and a washcloth. I know people were looking at me like I was crazy, but I'm in the bathroom. I'm just trying to get this pain, alleviate this pain that I was feeling all on my shoulders and my back. I mean, literally, I'm taking my shirt off. I'm doing all kinds of craziness because it was so painful from being out in that sun. So I knew then, but I just figured, you know, being out in the sun too long, it was just one of them things. Playing basketball, sometimes we used to play out in the sun, and I would get the same thing. And now, after realizing and what it is, Polycythemia Vera, how they say, okay, now I'm starting to flashing back to the things that started happening to me when I was younger. And now, as I'm getting older, they started progressing. Oh, that's what it was. But I didn't know that then. I just thought it was a part of life. Now I fully understand what it is.
Thank you. Another question is, are there any support groups for you and or your family for people with this illness, with PV?
Honestly, I have not really checked into that. And that's probably something I should do, because even though I'm dealing with it, and I'm dealing with it well, I think, I stay in touch with my doctor. I do my regular phlebotomy tests every quarter. I get my numbers and all that kind of stuff. So I'm handling it. But I'm sure there are people out there, they hear the word cancer and just freak out, you know? So for me personally, I am not familiar with any support groups, but I think that's probably something I should probably maybe check into, so I can tell my story to them and let them know I've been dealing with this pretty much since I was 40, 45 as far as being diagnosed, but I've been dealing with this. Honestly, when I sit back and think about some of the stuff that's happened, I've been dealing with this probably since late junior high school years.
Okay, thank you. Also, how is this disease different from leukemia, which is also a cancerous blood disorder?
So from my understanding, and once again, I'm no doctor, so I'm not 100% sure on this.
Yes, sir.
But from my understanding, leukemia is more towards white blood cells. And there are also some kind of symptoms associated with leukemia. But when it comes to polycythemia vera, it's more towards red blood cells. And in general, there's no outward symptoms in a sense. You don't have a crazy growth or, you know, some kind of crazy pain. You know, you're not urinating blood or stools in the blood, anything. None of that. None of that is part of the symptoms as far as for the most part, until, as I said in the video and as I stated in my slide, unless you have some kind of cardiovascular event, meaning a stroke or a heart attack, you won't know you have it unless you get a routine checkup from your doctor and they do your blood work. You would never, I had, like I said, once I realized all these little things that were happening to me as I was getting older, once I found out what it was, okay, now I see those symptoms. But, and some people, you know, dry skin is dry skin. Some people have dry skin, you know, it's just one of them things, you know. Some people, you can't be out in the sun too long, but you get them sunspots and all that kind of. So that's some of them things, some people just associate it everyday life things. But once I started putting all of them together and then looking at polycythemia vera, okay, I've had those symptoms, but I just thought they were life symptoms. Nothing crazy, like the traditional cancer type of symptoms. So.
Thank you.
Mm-hmm.
Well, that seems to be all the questions for tonight.
I have a question.
I'm sorry, we have one more. Thank you.
Are you able to donate blood?
So as long as my blood count is between 12 and 18, then ideally they want it below 18. If it hits 18, then I can't. But ideally, let's say, as long as my blood count is between 12 and 17 point whatever, then I can donate with no problem at all. But if my blood count is below 12 or higher than 18, they will immediately tell me, I'm sorry, you can't donate today and you need to go see your doctor.
Okay. Do we have any more questions out there?
Yeah, I have a question. So how about now when you have a wound or an injury? Does it take you longer to recover?
So for me, when I get cut or anything like that, yes. Because one, I'm taking baby aspirin, so my blood is a lot thinner. But also because of the way, you know, because I'm having this disease, this polycythemia vera, when I bleed, I can put a Band-Aid on, it'll bleed right through the Band-Aid. I'll put another Band-Aid on, it could bleed right through the Band-Aid. Sometimes when I give blood, they'll put an ice pack on my arm to squeeze the veins, because they'll put the ace bandage around my arm and they'll see the blood still coming through. So that's when I tell them, you know, you might have to put an ice pack on there. So they put an ice pack on there to constrict the blood vessels, so my blood will stop bleeding. But yes, right now, if I get cut, it takes longer for it to close up.
Thank you.
So, and just to add, my job, for me, I had to let my job know once I got done and came back from that angina, them thinking I had a heart attack. I had to let my job know that this is what I got, and some of the symptoms. So I am in the process of transitioning from field work to office work because I cannot take that chance. My job requires me to climb a ladder. I can't take that chance of being 2.5 stories in the air, and all of a sudden my vertigo kicks in. I can't take that chance. So now with them understanding, and just recently, literally just recently, I had to go see my doctor. We had to get the paperwork in place and fill it all out and all that stuff, so I can transition from being in the field to being in the office now. So it has affected my job as well.
Thank you.
Question.
Yes.
Do you find that the food that you eat or your overall diet, does that impact the severity of your symptoms, or does it play no role whatsoever?
As far as I'm concerned, the only thing that plays a role with the food is I just keep putting on weight. In all seriousness, though, as far as the dieting and stuff, no, I haven't been told anything as far as dieting. I haven't read anything as far as my research, as far as food intake. It's just a preference for me because I know high blood pressure runs in my family. So I try to stay away from salt. I mean, I don't eat salt at all. The table white salt, I don't fool with it at all. I can taste it, and my wife, I can taste it in my food a mile away if you put salt in the food. I don't fool with salt at all. Fried food, I don't eat fried food. Every now and then, you know, like I said, I need my little fried this and fried that. But for the most part, I don't do fried food. But this is just a preference for me. as far as my research is concerned, to answer your question, there's nothing that really states anything as far as diet is concerned.
I just one more question. So when you were first diagnosed with this condition, did you talk about it with your family? And do you think that's important to have family support?
Yeah, so you know, my mom and my dad, my sisters and my brothers know. Honestly, and I'm gonna tell you a story real quick. So when I first started to talk about, our first started posting about me talking about this, my next to youngest son, Jordan, actually called me on the phone and he lit me up. He literally lit me up because he's like, Dad, what is this? So I kind of explained it to him. And his next response was, and you think I didn't need to know that? And I was just like, my bad. You know, because they said it wasn't hereditary, I really didn't think that I should tell my kids. I'm sure we've talked about it, but nothing in detail. But after having my son rip me a new one, yeah, I'm going to definitely let my children know. Because when I say he laid into me big time, laid into me. So I would definitely let my children, like I said, my parents, my brothers and sisters, they all know, but I would definitely let my children know as well. Just right now, research, like I said, shows it's not hereditary, but I still would like them to get checked just to make sure. Because 100,000 people, so they're still learning about this. You know, it's considered a rare cancer. So they're still learning about this. So who knows? It might come out to be, it might end up being hereditary. I don't know, but I'm let my children know so they can get checked.
Any other questions? All right. Well, once again, I would like to thank Brother James for stepping up today and giving us a wonderful presentation and definitely some great information we can all use. So once again, I will piggyback a little bit and encourage every man on here, go get checked up. Just do your checkup. It's all right. It's not going to be that bad. I know we feared it a little bit. Thank you. And once again, let me please remind everybody, next Sunday, we will be having a panel of 5 prostate cancer survivors on here. And we'll love for you all to join us. Bring your questions, open mind, open heart, open ears to listen to get some new information. But like I said, thank you for joining us today. And once again, thank you, Brother James.
Thank you very much. Thank you everyone for showing up. Hope this was helpful. Get your physicals.
Definitely.
Thank you for that information.
You're welcome.